Public health concerns in the United States should be prioritized over public and individual privacy concerns in public health emergencies related to pandemics. In light of the current COVID-19 pandemic, this debate has been not only a hot topic in America, but all over the world. Currently, as the United States is in the midst of a pandemic, the United States has realized how unprepared it really was. Public health emergencies like COVID-19 rapidly spread, and without more action taken by the government, even more lives will be lost. COVID-19 has already taken over 70,000 lives in America and has transformed lives for Americans. Privacy should not be the priority in a time when the world is upside down. Therefore, I affirm that the United States should prioritize public health emergencies over personal privacy to help prevent and make sure that global health pandemics don't happen again. Public health emergencies should be the top priority in order to sustain a healthy environment, a stable economy, and a functioning society. So those are my 3 points that we will go over today. First, a loss of public privacy within healthcare should be expected in a pandemic because of the unknown health concerns that threaten to overtake the healthy environment. With any public health emergency, there's a level of unknown that comes with the sickness. There's an unknown on how and why it started, an unknown on how it is transmitted, an unknown on who is the most vulnerable to contract the sickness, and an unknown how to stop the spread. A healthy environment in the United States is jeopardized when the unknown is prevalent. And a way to help the unknown is to take away some aspects of privacy from United States citizens. An aspect of privacy that should be overtaken is from HIPAA and HIE. HIPAA stands for the Health Probability and Accountability Act, and HIE stands for Electronic Health Information Exchange. Therefore, the relationship between the caretaker and the patient should not be compromised, but the patient should be given but because the patient can be given useful information regarding the sickness, their information should be able to share to some degree. To sustain a healthy environment, dramatic steps need to be taken to stop the spread and to prevent later outbreaks. And through that, privacy should be compromised. Healthcare emergencies negatively alter the economy and leave millions without jobs. To help the economy get back to normal, technology is implemented into healthcare, which can result in the loss of privacy. When a health emergency takes over the world, there are different publics that are deemed essential and a priority will be put on those people. An example of this is healthcare workers. With limited healthcare supplies and the possibility of an unhealthy hospital, only a certain number of patients should be allowed to be in the hospital. To ensure that the safety of all is in mind, the use of healthcare via technology is key. The COVID-19 pandemic has shown that the new normal is going to be virtually for healthcare. Digitally enabled patient flows will be vital in ensuring that COVID-19 patients are only admitted into the hospital when necessary, and in a world that will also be accommodated non-COVID patients. With that, privacy can be lost over technology because there is always the aspect of someone taking identity. That is scary when the information that you're sharing with your doctor is very personal. The concern of public information and privacy isn't a new phenomenon but in this pandemic, actions like that need to be taken drastically in order to stop the spread. These actions won't last forever, but the more people that comply with the changes, the faster the changes will need to be in effect. So pretty much patients should be able to give up a little bit of their privacy by communicating with their doctor via technology. A normal functioning society is altered when a health crisis enters, so the expectation of privacy should also be altered because of contact tracing. Now, what is contact tracing? Contact tracing is whenever an individual is diagnosed with the coronavirus or whatever sickness is going on in the pandemic, every person who had possibly been near that infected individual during the period of time is contagious should be contacted and also told to self-quarantine for 2 weeks, okay? Countries like Israel, South Korea, and Taiwan have adopted a tracking system in their citizens to follow the spread. So this is how they know who has it and who they were contacted with in order to stop it. Again, this is not America, those are the 3 countries. Now, countries like that have taken an extreme, and it's a huge loss of privacy. But the United States should not take it that drastic, but they should implement some sort of app. Now, the thing is, these countries have proven that this tracking it's worked. So in the United States, the extreme of the tracking would never be adopted because of legal reasons and a huge loss of privacy, but there should be smaller measures that can take to stop the spread. Now, a big reason that this is important and will lose in stopping the spread is because a lot of people within the COVID-19 pandemic show no symptoms. If they were to use the app, they could self-quarantine and again, limit what is going on. So to go over my 3 points, the first one is that with the unknown and the unhealthy environment, there's some sort of privacy that should be compromised, and that's within HIPAA and HIE. Second, because of all the jobs lost, people should expect using healthcare via technology, which isn't bad. It's just there could be a level of degree of information that can be compromised because technology. And 3, there should be some sort of app taken to notify the person if they have coronavirus or to notify the people if they're around. I'd like to make a point with that the app would only be a yes or no question basis and really not take that much privacy, but there is some level that needs to be taken. Now, in a debate, so I mapped out some arguments that could happen. So first, against my HIPAA argument, somebody could argue that there should never be a violation of HIPAA, and the trust between the patient and healthcare workers could be lost and result in even longer lasting consequences. Yes, that is possible. But first, HIPAA will never fully be violated. HIPAA would only be violated if the patient had or had the virus connected with the pandemic. And that does not mean that the patient's information will be displayed to the public or misused. It just means that the information will be used in an ethical sense in order to research what is going on. Also, positive side to that, HIPAA can be violated for research, but to combat that, hospitals have actually blocked journalists from documenting stuff that's going on inside. So, second, online healthcare will discredit the healthcare system and create an untrusting environment. Well, first, healthcare workers will never be discredited if they are doing their job to maintain a healthy environment for the United States. In a crisis, when there's people working on the front line and caring for the ill, changes have to be made in order to protect those people, to keep them healthy. Communicating with a patient via technology will both protect the healthcare workers and the patient. It will be limited and it will limit the spread, and by forcing patients to stay at home and only come in for the doctor, it will be super critical in helping everyone involved. Third, contact tracing will never be beneficial because not enough people will ever voluntarily be tracked. Also, as American citizens, there are protections that will grant that people can't violate that. Well, first, contact tracing will only be implemented when it is contact tracing could be implemented, but not as intense as the other countries that I mentioned. They have apps and tracking on every single person. The United States will not be that way. The level of information given up will only be for research and to let other people know that they could be around someone that had coronavirus. It's all information to help those people. In turn, it will positively help more people, and because more people are going to be aware that they're at risk. It's all about education. Okay, those are my 3 points that I did in my argument, and